This is Dr. Paul Goldberg of the Goldberg Clinic. Today we are here with Kathy Seals and her husband Albert Drumheller.
Oakley.
I'm sorry, Albert Oakley. It goes by Oakley Drumheller. And they are from just outside Lynchburg, Virginia, in a little town called Forest. Forest is like a suburb of Lynchburg?
Basically.
Right. And we first saw you guys, was it September of just last year in 2015, and we're now in just the beginning of January of 2016. And Albert and Oakley and Kathy have come down to have their re-examination. And we're having a good time today, at least I am in particular, because we're getting a really good report. So we're here to report on our progress with Oakley and Kathy. And Kathy, what kind of problems were you having at the time when we first saw you?
Well, I deal with depression, clinical depression. I take medication for that. I also have asthma and take medication for that, several medications. And I was diagnosed a little over a year ago with fibromyalgia.
Mm-hmm.
Had really awful pain throughout my body, typical of that.
Yeah.
And since coming here, well, I'll tell you a story.
Did you have asthma also?
I had asthma.
You had asthma?
Mm-hmm. Yep. And when I was dealing with the fibromyalgia, there was a time when I could not walk to the end of my street, which was 2/10 of a mile. I walked my dogs, and I walked to the end of the street and could not make it back home.
You get out of breath?
Yep.
Yep.
No, and it was the pain. It was the pain from the fibromyalgia. It hurt so badly to take a step, all in my hips and pelvis and my back, and
This is when you walk, you have what, one or two beagles?
2 dogs, 2 beagles.
2 beagles, right.
I walked them to the end of the street, and I couldn't go any further. I had to call my husband and have him come get me. And now I'm back to walking an hour a day with my dogs.
I expect a thank you note from the dogs.
Yeah, I know, really. They do say thank you. You can't believe how excited they are when I get out the leash just now. But it's just been wonderful for the dogs and for me. Also, I'm doing very well. I saw my medical doctor recently, and he has cut me back on my Advair, my asthma medication, to once a day versus twice a day.
Excellent.
And another problem I had was sleep. And I wasn't sleeping soundly, wasn't getting enough hours of sleep. And I'd still like to go to bed earlier. I still go to bed too late, I think.
That's a work in progress.
It's a work in progress.
Yeah.
But I'm getting solid sleep, 8 hours or more.
Now, were you taking something to go to sleep?
I was taking trazodone.
You were taking trazodone. What's the status with the trazodone?
I'm not taking it anymore.
You're not taking it.
No. So I've cut my asthma medicine back, and I've cut out the trazodone, and I had allergies, so I was also taking Zyrtec, generic for Zyrtec, and I've cut that out. And I was taking glucosamine and chondroitin, and I'm not taking that anymore either. So
Okay.
all of those things have been cut out.
So the fibromyalgia has improved considerably.
I'm not having any pain.
Any pain? Wow.
No pain.
The asthma has improved
Yes.
considerably. You've reduced a lot of medications.
Yes.
What's happened with your weight?
I've lost 20 pounds.
You lost 20 pounds in just a couple months.
And I've gone from a size 16 to a size 10.
That's a lot.
That's a lot.
And you told me something about your skin. What's happened with your skin?
Oh, my skin. Well, everyone keeps telling me that my skin looks wonderful and it's glowing, but I've also noticed that it's much less dry. I had to use slather-on lotion before, and now I just put a little bit of lotion on, and that's enough.
Slather is a technical term.
Now, by the way, both, did I tell you that we were incontinence experts or explosive diarrhea experts?
No.
Did I tell you I was going to treat your asthma or your fibromyalgia?
You said you did not treat diseases.
That's right.
Yeah.
And your so-called diseases have been dissipating very, very
Yes.
rapidly.
Yes.
And I think that's an important point, that we don't hold to the treatment of disease. We hold to getting people healthy, identifying the causes of the problem, identifying it, addressing it, and then we get nice surprises like, we're not treating your skin,
Yeah.
and your skin gets better.
Right.
We weren't treating the incontinence, explosive diarrhea, that goes away.
Yeah.
And of course, the key to all of this is not only us identifying what's wrong and telling you how to address it, but that you have both been very disciplined in wanting to get well and doing what needed to be done. So we'll take 10% of the responsibility for getting you well, and we'll give you the other 90% credit here,
Thank you.
both of you. Because that's always the key thing, is that the patients follow through and do what needs to be done. So we've only had a short period of time. We've already had dramatic improvements. We're looking forward to getting increasing improvements with both of you and continued long life and health. And thank you both for telling our audience about your improvements and your experience at Goldberg Clinic.
Thank you.
Certainly welcome.
Thank you. We appreciate it.
My pleasure.